Many seniors have heard the same advice about high blood pressure for years. Cut back on salt, take the medicine, watch the reading, keep the number lower, and yes, those things can matter. But here's the question many older adults still carry quietly in the back of their minds. If the number comes down, is the whole problem really under control? Or could something deeper still be happening inside the blood vessels, even when the monitor looks a little better? Because this is where many people feel confused. They do what they were told. They take the tablets. They try to be careful. They feel relieved when the reading improves. But what if the reading is only part of the story? What if the number gets better while the blood vessels themselves are still under strain? Hello everyone. Welcome back to Senior Health with Dr. Sarah Mitchell. Today, we are going to talk about hypertension in a much deeper and clearer way. Not in a dramatic way and not in a cold medical way, but in a way older adults can actually follow and use. Because if you are over 60 or helping a parent, spouse, or loved one, it helps to know that high blood pressure may be more than a number on a screen. It may also be a sign that the blood vessels themselves are changing over time, and that is where the bigger story begins. Let's slow this down and make it simple. Many people picture blood pressure like water moving through household pipes. If the pressure is high, then the answer must be to reduce the pressure. That sounds simple, and part of it is true, but it is still not the whole picture. Your arteries are not simple pipes. They are living tissue. They have an inner lining. They have muscle in the wall. They have stretch. They are meant to widen, relax, respond, and protect the body with every heartbeat. So when blood pressure stays high for years, the issue may not only be the number itself, the issue may also be that the blood vessels are becoming less smooth, less flexible, less calm, and less able to do their job the way they once did. And this is where many people get the wrong idea. They think that if the pressure reading improves, then the whole problem must be solved. But in many cases, the reading is only one part of the picture. A person may see a better number and feel relieved. Their family may feel relieved. Even the doctor may feel pleased that the pressure is more controlled than before, but if the deeper health of the blood vessels is still poor, the body may still need attention in ways that do not show up clearly on the monitor. That is one of the biggest hidden problems with hypertension. A better reading can create a sense of safety, even while the body may still need much more support beneath the surface. Imagine a man in his late 60s who has been on blood pressure medicine for years. At each visit, his numbers look better than they used to. He feels fairly normal most days. He tells himself he must be doing fine because the top and bottom numbers are lower now. His family believes the problem is being handled. He believes the same thing. But little by little, he notices he gets tired more easily. His walking feels slower, stairs feel heavier than they used to. He has less stamina, but he tells himself that must just be age. Then later he learns that his arteries are much stiffer than anyone had really been focusing on. The reading improved, but the deeper vessel health still needed attention. That contrast matters, because one person feels too safe because the number improved, and another person feels too afraid because the number went up. But both may be missing the deeper message. So now let's look at the first deeper layer. Inside every blood vessel is a very thin lining. You can think of it as a protective inner surface that helps blood move smoothly. It helps the vessels stay calm. It helps prevent too much irritation. It helps the vessels widen when they need to. When that inner lining is healthy, the blood vessels usually function better. When it becomes irritated or damaged, the vessels may become less relaxed, less protective, and more likely to stiffen over time. This part is easy to miss because you cannot feel it happening. There is no simple warning light for it, but the body may be under quiet strain for years before a person realizes anything is changing. What can wear that inner lining down? Several things may play a part. Frequent blood sugar spikes, smoking, long-term inflammation, poor sleep, long periods of sitting, highly processed food patterns, ongoing stress, extra weight around the middle. These do not always cause clear symptoms at the start, but over time, they can affect the inner health of the vessels. And once that lining becomes less healthy, the whole pressure system can start behaving differently. The vessels may not widen as well. They may stay more tense. They may react more strongly. Pressure becomes harder to manage in a steady, lasting way. And this is where things begin to change. Because now the question is not only, how do I lower the number? The better question becomes, what may be making my blood vessels less healthy in the first place? That is a much better question because it opens the next layer. The next layer is stiffness. Healthy arteries are not just open inside. They are also able to stretch and settle back. That stretch matters more than many people realize. When the heart beats, the large arteries are supposed to soften some of that force. They act almost like a cushion. They take some of that pressure and smooth it out. But when those arteries become stiffer, they lose that cushioning effect. They do not stretch the same way. They do not settle back the same way, and that changes the whole pattern of blood pressure. This is one reason some older adults have a top number that stays high while the lower number looks less concerning. Sometimes the lower number even looks normal, and that gives a false sense of comfort. But a wider gap between the top and bottom numbers can sometimes suggest that the larger arteries are not handling pressure as smoothly as they once did. This is the part many people miss. They look at the reading, but they do not think about what kind of artery produced that reading. A softer, healthier artery and a stiffer, older artery may not tell the same story, even when the numbers seem familiar. Let's pause here, because this really matters. Not every person with a wider gap is facing an immediate emergency, but it is a pattern that deserves attention, not dismissal. It may be showing that the blood vessels are aging in a way that needs more support, even if the person still feels mostly fine. And stiffness usually does not appear in one dramatic moment. It builds. A little more inflammation, a little less movement, a little more strain from sugar swings, a little more stress, a little poorer sleep, a little more irritation in the vessel wall, a little less flexibility year after year. That is why hypertension can be so deceptive. People think the whole issue is today's reading, but often the body has been changing quietly in the background for a long time, and that is where the real trouble often grows, not from one dramatic day, but from smaller changes, repeated quietly for years. Now think about a woman in her early 70s who checks her blood pressure often. One higher reading can spoil her whole day. She becomes frightened. She goes online, reads 3 different opinions, hears 4 different warnings, and by evening she feels more confused than before. One person tells her salt is the whole problem, another says stress is the main issue, another says she may be close to a stroke. But what she really needs is not more fear. She needs a clear explanation of what may be happening in her blood vessels, what habits may be making things worse, and what steady steps may help support her body more wisely. Fear alone does not help. Clear guidance does. Now here comes the third deeper layer, and this is another place where many people are given too little explanation. Blood sugar, insulin, and blood pressure are often more connected than people realize. Even before a person has full diabetes, the body may already be struggling with sugar control and insulin. And when that happens, it can affect inflammation, weight gain, the way the kidneys handle sodium, and the way blood vessels respond. So some people are told to focus only on salt, while the bigger issue may also be that the body is under repeated strain from sugar spikes, insulin resistance, poor sleep, central weight gain, and low activity all at the same time. This does not mean salt never matters. It can matter. But it does mean the full picture is often wider than people were told. If someone is eating a lot of processed food, getting frequent sugar spikes, moving very little, sleeping poorly, and carrying extra weight around the middle, then blood pressure may be rising from several directions at once. That is why a fuller plan makes more sense than a one-part answer. And this is where many people feel stuck. They are trying to solve a bigger problem with only one small tool. That is why some older adults feel disappointed. They take the medicine, they try to be careful, they still see strange readings, they still do not feel fully right, so they begin to wonder whether something was missed. In many cases, what was missed is not that the number does not matter. It is that the number is only the surface of a bigger story. So what should a wiser approach look like? The first step is to stop thinking about hypertension as only a number problem. Yes, the reading matters. Yes, medicine may be important and protective. But you should also ask what may be pushing the reading in the first place. Are the vessels losing flexibility? Is blood sugar often running high after meals? Is sleep poor? Is stress constant? Is movement too little? Is smoking part of the picture? Has the diet slowly shifted toward packaged food and away from simpler whole foods? These questions begin to reveal the deeper pattern. The second step is to support the inner health of the blood vessels with daily habits that make sense and that people can actually keep doing. That may mean fewer sugary drinks, fewer pastries, fewer heavily processed foods, less white bread and snack food, and more vegetables, beans if they suit you, berries, oats, fish, eggs, olive oil, nuts if tolerated, and meals that do not send blood sugar sharply up and down. It may also mean paying more attention to food quality, not only labels that sound healthy. Many foods sound safe, but still leave the body under strain day after day. The third step is movement, but in a realistic way. Not punishing workouts, not anything unsafe, just regular movement that the body can handle. Walking matters. Light strength work matters. Gentle daily activity matters. When the body moves more often, circulation often improves, sugar handling often improves, and blood vessels may respond better over time. Some people also use simple hand grip exercises as part of a home routine, done safely and sensibly, because small repeated efforts can sometimes support healthier pressure patterns when they are part of a wider plan. The point is not a trick. The point is to keep the body engaged, working, and adapting. And this is where many older adults need encouragement. Do not wait until you feel perfect before you begin. Sometimes safe movement is what helps start the change. The fourth step is sleep and breathing. Poor sleep can make blood pressure harder to manage. Snoring, broken sleep, waking tired, sleeping with the mouth open, or never feeling refreshed in the morning may all deserve closer attention. When sleep stays poor for months or years, the body often feels it in more ways than one. Energy drops, stress rises, blood sugar becomes harder to control, pressure patterns become less steady. So sleep is not a side issue. For many people, it is part of the main issue. The fifth step is to work with your doctor on the bigger picture, not only the number. This part matters a lot. I am not telling anyone to stop blood pressure medicine on their own. That can be dangerous. For many people, medicine is necessary and protective. But medicine often works best when it is combined with a fuller plan that also looks at vessel health, food quality, blood sugar patterns, sleep, movement, and long-term habits. The goal is not to fight your doctor. The goal is to bring better questions to the conversation. For example, instead of asking only, "What was my reading today?" you may ask, "What patterns are you seeing over time? Do my numbers suggest stiffness in the arteries? Should I look more closely at sleep, sugar control, or weight around the middle? How can I support my vessel health along with taking my medicine?" These are strong questions. These are useful questions. These are the questions that move the conversation forward. Now think of a retired couple in their 70s. The husband takes his tablets but keeps eating the same processed snacks, sits most of the day, sleeps badly, and tells himself the medicine should handle the problem. The wife starts walking every morning, cuts back on sugary foods, keeps a simple log of her readings, notices which days she sleeps poorly, and talks with her doctor about those patterns. Over time, she begins to feel more in control, while he still feels like blood pressure is just something that keeps happening to him. That shift matters. The more a person understands the deeper pattern, the more wisely they can work with it. Now here is one more point I do not want you to miss. A better blood pressure plan is not only about avoiding future problems years from now, it is also about protecting daily life now. Better vessel health may support steadier energy, better walking tolerance, clearer thinking, less strain on the heart, and a better chance of staying independent longer. That is what many seniors truly care about. Not only a number on a machine, but how they live, move, think, and feel from week to week. And that is why this topic deserves patience, because when people only hear lower the number, they may miss the deeper opportunity. The deeper opportunity is to support the blood vessels themselves, not overnight, not perfectly, but steadily. So what should you do after this video? Start simple. Look at your blood pressure readings, but do not stop there. Ask what may be pushing them. Watch for patterns over time, not just one reading on one day. Pay attention to sleep, movement, sugar strain, food quality, stress, and body changes that may have been building quietly. Support the blood vessels with better food, steadier movement, better sleep, and better follow-up. Take your medicine as prescribed unless your doctor changes it. Bring real questions to your appointments. And do not assume that a lower number always means the whole problem is gone. Because the deeper goal is not only a better reading. The deeper goal is healthier blood vessels, better support for the heart and brain, better daily function, and a safer future. So let me leave you with this clear takeaway. Hypertension is often more than a pressure problem. In many older adults, it may also reflect changes in the blood vessels themselves, changes that build slowly and deserve more than a quick fix. Once you understand that, you stop chasing only the number and start asking better questions, making better daily choices, and building a fuller plan with your doctor. Thank you so much for watching Senior Health with Dr. Sarah Mitchell. If this video helped you understand hypertension in a clearer and more useful way, please like, subscribe, and turn on the bell so you do not miss our next videos. This video is for educational purposes only and does not replace medical advice, diagnosis, or treatment. Please speak with your doctor or qualified healthcare professional before making changes to your medicines, supplements, food plan, exercise, or treatment routine. Please take care, stay safe, and may you have better health, more peace, more comfort, and more strength in the days ahead.